COVID-19, kidney injury and need for a vaccine shot. A Mayo Clinic study into the body's immune response to the virus supports the need for widespread vaccination. As of early September 2021, the COVID-19 pandemic caused by the SARS-CoV-2 virus has affected over 200 million people and led to 4.4 million deaths worldwide. In India alone, 3 crore 30 lakh COVID-19 cases and 4,42,000 COVID-19 related deaths have been reported to date. While most infections are mild with respiratory symptoms, a severe form of the disease is seen in older adults and people with chronic heart, kidney and lung diseases, diabetes or other conditions that render the immune system weak. COVID-19 damages many organs including the lungs, heart and kidneys. Commonly seen complication. Kidney injury as a complication of COVID-19 is more commonly seen in hospitalized patients. While the reported prevalence of kidney injury was 7% in a study of 2,650 patients admitted to a large hospital in southern India, a recent large study in the United States reported kidney injury in as many as 46% of 3,993 hospitalized patients, of whom 19% required dialysis. Patients with COVID-19 kidney injury also have increased duration of hospitalization, with increased healthcare costs. Unfortunately, there are many more deaths in those who have acute kidney injury. Understanding the microscopic changes in kidneys after infection with the SARS-CoV-2 virus is important and has been the focus of extensive research. Researchers, especially pathologists, across the globe have been unified in their observations of COVID-19 kidney injury, i.e., acute tubular injury, injury of the transporting channels in the kidney, is the hallmark of kidney pathology. Thrombi or blood clots, as seen in the lungs and heart, may also be seen in the kidney. Inflammation, influx of white blood cells, in the kidney has also been described by researchers. The kidney injury is more commonly seen in kidneys that already have chronic injury, such as that seen in diabetes or severe blood vessel diseases. The exact process in which the SARS-CoV-2 virus brings on the kidney injury has been studied to varying detail by different centers. The first question asked is, does the virus directly damage the kidney? Many centers across the globe have used a very special microscope called the electron microscope to look for evidence of virus in the kidney. The initial studies that emerged from China and the United States seemed to identify structures within kidney cells that looked like viral particles. This seemed to be logical, given that the kidney has a high concentration of ACE2, which is the key protein structure on a cell that the SARS-CoV-2 virus attaches to. This step is critical for the virus to enter the cell. Returning to school 17 months later. The post-COVID-19 situation is complex and the where we left it approach will not do for any stage of school education. As children return to the classroom after an unprecedentedly long gap, many among their teachers realize that teaching will be tougher. And there are others who assume that it will be business as usual. In fact, they have already started teaching from the point where we left it, meaning where they were in their online classes. Teachers who stick to the syllabus no matter what happens in the outside world, like to identify themselves as teachers of this or that subject. They see their role purely in terms of the knowledge they enable children to acquire. They view the purpose of education in terms of success in examinations and, consequently, in life. With a sense of purpose so firmly held in their minds, such teachers stay clear of the personal life of children, especially its emotional aspect. We can understand how such teachers define learning, in terms of the prescribed syllabus as articulated in the textbook. There is no harm in acknowledging that teachers of this sort form the majority in the profession. Though in a minority, there are other teachers who realize that education is more than about completing the syllabus to prepare children to face examinations. These teachers know that their success as teachers depends on how they relate to children, no matter what subject they teach. For this reason, they worry about their children's emotional well-being. When a child is not feeling well, such teachers ask what is wrong. They recognize individual differences and engage with children as persons with specific habits of mind and behavior. For such teachers, the world outside the school matters because it makes an impact on children, their spirit and enthusiasm for what they are being taught in the classroom. For teachers of this kind, the long gap caused by the novel coronavirus pandemic in their daily routine interaction with children has made it problematic to resume teaching. They know that 17 months without teaching in a physical classroom has made a strange impact on themselves as well as on the children they teach. Gap impact. Several obvious reasons can be cited. One that has been widely discussed comes under a poorly conceptualized title, learning loss. If small children cannot read at the level they had attained before the pandemic struck, this can hardly be described as a loss. The terminology of loss and gain seems natural in our times, but it is unsuitable for discussing children and their development at school. When they are small, children do not easily retain for long what they had picked up unless it is put to daily use. This is just as true of the facility in reading as in intellectual capacities to comprehend, analyze and judge. However, the facility once acquired returns when its need is created.